Can prenatal genetic screening be done for twins? In recent news, many expectant parents are asking an important question. Can prenatal genetic screening be done for twins? With advancements in technology, this topic is trending as families seek to understand their options. If you are expecting twins or know someone who is, this information is timely and relevant. Let's break down what you need to know about prenatal genetic screening for twin pregnancies. Yes, prenatal genetic screening can indeed be performed for twin pregnancies. However, there are specific considerations compared to singleton pregnancies. Genetic screening aims to assess the risk or presence of chromosomal or genetic abnormalities in developing fetuses. In twin pregnancies, both fetuses can be screened. The approach taken depends on whether the twins are identical, also known as monozygotic or fraternal, referred to as dizygotic. The type of genetic test being used also plays a role in how the screening is conducted. Non-invasive prenatal testing, often called NIPT, analyzes cell-free fetal deoxyribonucleic acid circulating in the mother's blood. This test can be done for twins, but it may have a higher chance of inconclusive results. Laboratories usually report a combined risk for both twins rather than separate results for each fetus. Invasive diagnostic tests like chorionic Villus sampling or amniocentesis can also be performed for twins. These tests requiring careful planning, as separate samples may be taken from each fetus. This is especially important if the twins do not share a placenta. For those considering in vitro fertilization, preimplantation genetic testing can be done on embryos before implantation. This screening process involves biopsying cells from embryos at the blastocyst stage. This is particularly useful when multiple embryos are created, which may lead to twin pregnancies if more than one embryo is transferred. Early pregnancy monitoring after embryo transfer includes blood tests and ultrasounds to track implantation and development. Overall, prenatal genetic screening for twins is feasible and commonly done. However, it requires specialized interpretation and sometimes more complex procedures. Consulting with a genetic counselor or maternal-fetal medicine specialist is recommended to choose the most appropriate testing strategy for twin pregnancies. This ensures that expectant parents are well informed and prepared for the journey ahead.